gone to the doctor for relief from nagging pain or overwhelming anxiety. After a brief consultation, leaving with prescription in hand, was certain that the medication that was prescribed will help you feel better. But soon, you find yourself in a frightening downward spiral. What was once started as a solution has turned into dependency, threatening your health and relationships. Every year, countless individuals fall into this trap, unaware that prescription drugs meant to heal can become a pathway to addiction. This harsh reality of prescription drug abuse is an escalating crisis that often goes unrecognized. It's a bitter pill to swallow, understanding the prescription drug abuse epidemic that's going on. Prescription drug abuse does not discriminate. It impacts people of all ages and backgrounds. In this room, some of you may have experienced or know someone who has battled with this issue. As someone who has witnessed the consequences of the prescription drug abuse within my own community, I feel compelled to discuss its risks and share the information that can help prevent its devastating effects. Prescription drug abuse poses significant dangers to individuals and society, and understanding its prevalence and health effects and prevention strategies is essential to combat this growing epidemic. Today, I'll explain the prevalence of prescription drug abuse, discuss its harmful effects on users, and outline strategies that can help prevent this issue. First, we'll start with the prevalence of drug abuse. The misuse of prescription pain relievers, anti-anxiety medications, stimulants, and sedatives has reached an epidemic level in the United States of America. According to the National Institution of Drug Abuse, NIDA, approximately 18 million people in the U.S. misused the prescription drugs in 2020. Common forms of drug misuse can include taking medication not prescribed to you, using medication for non-medical reasons, and modifying administration routes that can include crushing up, snorting, and or injecting medication into the bloodstream. A significant factor contributing to this epidemic is the overprescription of narcotics for pain management. Narcotics and pain management, like medication that is used to help relieve pain, such as Ativan, morphine, fentanyl in some cases. With that, the Center for Disease Control and Prevention, CDC, reported that opioid prescriptions increased dramatically in the late 1900s. This has correlated with the rising rates of addiction, overdoses, and fatalities nationwide regarding prescription pain medication. The perception that prescription drugs are safer than illegal drugs has led to alarming misuse rates among adolescents and young adults, meaning people that are under the age of 21, but in between the ages of as young as of the age of 18. Furthermore, the misconception that prescription drugs are safer than illegal drugs has led to the alarming rates again of misuse in the young adults. It's just not adults that are affected by these epidemics. It's often perceived that the young people nowadays may also be affected because prescription drugs are often seen as less harmful, especially among teenagers. Prevention starts with awareness. In 2021, the Monitoring the Future survey noted that nearly 3% of high school seniors reported misusing prescription drugs, and many teenagers, again, perceive that prescription drugs are okay to use because they are prescribed by a doctor. They must be safe and harmless, even when used outside of medical guidance. This misperception can lead to risky behaviors such as combining prescription medications with alcohol or illicit drugs which can further increase the risk of overdose and long-term harmful events. Understanding the prevalence of prescription drug abuse invites us to explore the severe consequences it has on both the physical and mental and psychological health of individuals. Prescription drug abuse can lead to severe physical health consequences. Long-term events of using opioids can lead to physical dependency and withdrawal symptoms that can make resuscitation difficult. Users may experience muscle pain, anxiety, and insomnia when attempting to stop. A study published by the New England Journal of Medicine found that approximately 21 to 29% of patients prescribe opioids end up misusing them in the end. The risk of overdosing increases dramatically with the combination of prescription medications and other substances such as alcohol. With that, mental health is also significantly impacted, with research indicating that those who abuse prescription drugs often suffer from depression, anxiety, and disorders linked to the co-occurring substances used with mental health, according to the NIDA in 2021. With that, and understanding the deeper meanings of the dangers of prescription drug abuse, it is crucial to develop preventative measures that can be taken to combat this issue. Here are some prevention strategies to combat drug abuse. One, educating is an important place to start. Educating patients and families on these medications about the risks associated with prescription can significantly reduce misuse. Implementing prescription drug monitoring programs, PDMPS, allows healthcare professionals to track patient prescriptions and avoid overprescribing. And often, with that, community outreach and awareness campaigns can also play a key role in prevention. Programs targeting schools, parents, and healthcare workers are crucial in spreading the message about safe medical practices. Here are some resources for individuals struggling with drug abuse. We have the Texas Addiction Hotline and the SAMHSA National Hotline as well. Call those or give them to anybody you may know who may be struggling with any type of drug abuse, whether it's prescription or not. Today we explored the alarming prevalence of prescription drug abuse and the grave health consequences it possesses and effective strategies for prevention. Understanding the danger of prescription drug abuse is vital for safeguarding our health and the well-being of our loved ones. By being informed and proactive, we can combat this alarming trend. In return to the introduction challenge or other messages, as we reflect on this issue, I urge each of you to please consider your role in addressing prescription drug abuse. Just like any other battle against addiction, it requires awareness and conversation, and of course, community support. Let's work together to ensure that the next generation does not have to face these bitter pills that we have on their own. Thank you.